ESMO 2020 has been really exciting for urological cancers. It's very disappointing that we can't be there and spend time together and see these presentations presented in live. But nevertheless, the ESMO 2020 platform on the virtual platform has been excellent, and it's been easy to access all the presentations and the discussion that happens afterwards. I have a few key takeaways I wanted to kind of share with you. Prostate cancer, we don't appreciate, but it was the original cancer where precision oncology was involved. We identified the androgen receptor as the oncogene for prostate cancer, and we targeted it with androgen deprivation therapy. And whilst it may seem that we haven't been part of the precision oncology era in the prostate cancer space, we really have been. We were there at the beginning. But we've made some major steps to bring ourselves back into that game more recently. First was with the profound data presented at ESMO last year in 2019, and updated survival data presented this year by Joaquin Mateo, who demonstrated that there was in fact a significant overall survival benefit for olaparib for patients with BRCA1 and 2 mutations and ATM mutations. That's really exciting, and we hope to see that used in practice soon. The other data presented from prostate cancer was that of the IPATential study presented by Johan de Bono, and also in the presidential session. IPATential, this study involved the use of Ipatasertib, which is an AKT inhibitor, and again, in a personalised or precision oncology approach, patients with P10 loss or P10 mutations were those that seem to benefit the most. So whilst there was a clear radiological progression-free survival benefit, the data for overall survival are still immature, and we hope to see that data read out soon. Okay, we also saw some data presented in urothelial cancer, and whilst not as exciting as that seen in prostate cancer, it does reaffirm what we've known for many years, and that is that platinum-based chemotherapy is very effective for urothelial cancer. So we saw Dr. Alva present Keynote 361, which is a study in first-line urothelial cancer looking at chemotherapy plus or minus pembrolizumab. Unfortunately, there was no significant survival advantage seen with that combination, but we look forward to seeing the data in print. The DANUBE study looking at an IO doublet, that of tremelimumab and durvalumab, versus chemotherapy by itself and versus durvalumab by itself, also showed that chemotherapy, in fact, was very effective with the IO doublet and the PD-L1 inhibitor alone, not showing any significant survival benefit. So we continue to make progress in bladder cancer, or urothelial cancer. It's been an area which has had very little research for many years, but over the last 3, 4, or 5 years, we've seen a lot of studies demonstrate benefits to this patient population. One other area which continues to explode is that of kidney cancer. And we saw Tony Choueiri present in the presidential session at ESMO 2020 the data from the CheckMate 9ER study, which looked at the combination of cabozantinib and nivolumab, again demonstrating quite a significant overall survival benefit over Sutent alone. Very exciting to see this data presented. It now presents us with the issues of which treatment to select. We have multiple treatments now approved for first-line treatment of metastatic clear cell renal cell carcinoma, and this is up to us now as clinicians to determine how to best select patients for our best select treatments for our patients.